Dresden, Germany. On a recent winter morning, Gertraud Bauer and Gordon Noack went shopping in communist East Germany. "Here we have a lunchbox," said Carmen Misich, who appeared to be a sales assistant at the Intershop store, an upscale communist-era establishment where the women were examining merchandise. "This used to be so popular," Bauer responded with a smile, "and the bread in it was always fresh," added Noack, gazing into the distance. The two 93-year-olds spent much of their lives in the former German Democratic Republic, GDR. Now, decades later, the vanished communist era appeared, at least for them, to be back. The Intershop store they were browsing in was, of course, a reproduction, and the song playing in the background, "Old Like a Tree," had long ago disappeared from the radio. Then a door opened and a nurse came in. It was time for the two Alzheimer's patients' daily nap and, for now, an end to their retro shopping tour. Bauer and Noack, who live in a nursing home in this eastern German city, have suffered for years from Alzheimer's, the degenerative disease that robs patients of their capacity to remember. For just a few minutes, however, they give the impression of having overcome their condition and regained control over their memories. To them, life in formerly communist East Germany, a country that merged with West Germany after the fall of the Berlin Wall in 1989, is more vivid than experiences they may have had only minutes ago. People with dementia often still have a good long-term memory, whereas their short-term memory does not really work anymore. They may not remember relatives and family so well, but they can remember very well certain details from decades ago, said Ursula Beer, a volunteer at the nursing home. The Alexa nursing home where Noack and Bauer live is trying to trigger such memories by recreating settings from the communist era as a form of therapy. While other nursing homes are also trying to help their residents remember details of their lives, what is going on here could well be the only concerted effort to recreate for its residents an entire historical era. At the beginning, we had no real idea how we could give the residents some of their vitality back, said Gunter Wolfram, the nursing home's 49-year-old director. Dementia residents often have this challenge of being unable to structure their own lives and not really knowing what to do with themselves. One widely used form of therapy involves showing patients the old tools of their trade, for example, giving a former hairdresser combs, to reactivate memories. But that approach seems to work only if the patient was enthusiastic about his or her line of work. In East Germany, where one's choice of professions was heavily regulated by the state, few were. The response was much more striking when Wolfram bought a 1960s-era East German motor scooter more than 2 years ago to decorate his nursing home. They remembered features of the scooter and told us stories about how they had gone on trips with their friends in the past, he said of the patients. He went on to buy other items commonly used in communist East Germany during the 1960s, including old radios, passports, hair dryers, even widely known ice cream advertisements.